Hello dear colleagues, this is the CT scan of a young patient who presented with complaint of assault. Have a look at the CT scan. So here we can see that there is fracture of the inferior wall of left orbit with herniation of the fat into the left maxillary sinus. These findings are better appreciated on coronal imaging. Here we can see there is herniation of the fat. This is the soft tissue window. Here we can see there is herniation of the fat but no herniation of the extraocular muscles. So this is the case of inferior orbital wall blowout fracture. This is easily missed if we don't see coronal sections, which may result in irreversible damage to the patient. Another important thing is that this is the site of infraorbital nerve and artery, which can also be trapped within the herniated fat. So orbital blowout fractures are defined as fracture of one of the wall of the orbit but with intact orbital rim. This is typically caused by a direct blow to the central orbit from a fist or ball, which causes a sudden increase in intraorbital pressure. Presentation and diagnosis may be delayed due to extensive soft tissue swelling and an intact orbital rim. Clinical findings of diplopia and restricted ocular motions may be temporarily masked by intraorbital swelling. Out of all orbit blowout fractures, inferior wall blowout fracture are the most common but are easily missed on imaging. Orbital fat prolapse into the maxillary sinus and sometimes may be associated with prolapse of the inferior rectus muscle. X-ray of the face sometimes may be helpful in diagnosing this entity, on which inferior herniation of fat shows teardrop sign. CT is the modality of choice for diagnosis of orbital blowout fractures. All three planes should be reviewed. CT scan help us to exclude entrapment of the extraocular muscles, intraorbital hemorrhage, globe or optic nerve injury, which may require prompt attention. Usually the management is conservative, but depending on the severity of the symptoms, surgical intervention may be done. Thank you.